Ninth month of pregnancy. In the ninth month of pregnancy, the signs of an impending birth are becoming more noticeable. The frequency of Braxton Hicks contractions also increases now. Engaging pains can bring the baby to its final birth position. In the case of babies who are born for the first time, it occurs earlier than in women that they already have children. The final effort until delivery. The mother and baby are now creating mainly energy reserves. In the ninth month, the maturation of the baby's lungs finally ends. In the ninth month, maternity leave begins, which must be used to take time and rest your body and mind in the last weeks before the birth. The baby in its ninth month of pregnancy, growth and reserves of energy. In the ninth month, the baby's main concern is to grow and accumulate reserves of energy. In the first week of this month she is about 17 inches long and weighs just under 2,000 grams. By the end of the month her height will be about 47 centimeters and the weight of it will be about 2,700 grams. The baby's range of movement has been greatly reduced in recent years. Weeks. With her body, she now touches the wall of the uterus. Therefore, the mother also you will notice smaller movements clearly and often also quite painful. Towards the end of the ninth month, many babies fit their heads into the pelvis of their mother, which means that they have entered the immediate starting position for the birth. However, in the case of women who have already given birth before, only it will happen shortly before they are born. In the ninth month of pregnancy, around the middle of the month, the lung maturation of the baby. In case of delivery between week 34 and 36 of pregnancy, the baby is still considered premature, but as a general rule, doctors and midwives will do nothing else to stop the birthing process for some time. At this time, the child has all the necessary capacities to live outside the maternal womb. The senses are fully developed. Her brain volume too increases significantly in the ninth month of pregnancy. The bones are largely developed, but the child's head remains soft and flexible until well after birth. So far, the baby's cranial plates are not connected by structures bone, but by internal and external layers of the skin, the fontanelles. After the at birth, the fontanelles are protected by firm connective tissue. The small fontanelle at the back of the head closes until the end of the third month of in life. The large fontanelle will only ossify in the second year of life. The baby is accumulating an increasing amount of energy reserves, is accumulating fat. Such reservations are absolutely necessary for the first days after birth. Initially, only the so-called colostrum is available, I eat food. The baby has an increased need for calcium until birth. Trace elements are essential for healthy bone development. In the ninth month of pregnancy the essential thing is a healthy bone development. The baby's calcium level is already now greater than the mother's. This requires a diet that is particularly rich in calcium until birth. Important for this are, among other things, many dairy products and a sufficient supply of vitamin D, which promotes the absorption of calcium in the body. In the baby's intestine, more and more meconium is deposited in the baby's intestine. Baby, which is excreted as the first bowel movement after birth. The mother in the ninth month, the last effort before delivery. In the ninth month of pregnancy, the mother's body is already preparing to intense form for the imminent delivery. The upper border of the uterus now reaches the sternum height. The breasts often secrete colostrum. The inconvenience caused by pregnancy are more and more pronounced. The pregnant woman's blood volume continues to increase in the ninth month. Many women still suffer from low blood pressure because it is harder for women to veins pump blood from the periphery of the body back to the heart. Women who are expecting a child for the first time often experience the called soreness pains in the first half of the month. These are not usually very painful, they feel more like a slight pull in the direction of the pelvis. This brings the baby's head down into the pelvis. From the ninth month of pregnancy, the mucus plug can be expelled. Here I know loosens the mucus plug that has previously closed the cervix and that partly it can carry blood. The expulsion of the mucus plug occurs in the form of a discharge thick and partly also bloody. If it is caused by Braxton Hicks contractions or nesting pains, still delivery may be several weeks away. If at the same time there is also regular and gradually increasing contractions, the birthing process has already started. Legal maternity leave begins at week 34 of pregnancy. 6 weeks before your due date and 8 weeks after the baby is born, the mother will be on maternity leave. During this period, Social Security is responsible for paying part of the salary, and the company is responsible for paying the rest. Until the time of delivery, mothers who wish to continue working at their own request can agree to an exemption with their company. After childbirth, there is an absolute prohibition of employment during the period of birth. Official discharge. In the 9th month of pregnancy, all issues should be addressed related to leave and return to work. Thanks for watching this video. If you think this information is important, please support us subscribing to the channel. Leave us a like and a comment if you have any doubt. We will gladly help you. This video was created by the page and channel of Mothers in Happy Pregnancy. Thank you.